Today we are going to talk about something that does not affect women directly, but really it does indirectly. Male infertility. So what are some of the habits that really do contribute to infertility in men? What are some of the causes, prevention, and treatment options? My name is 𝗕𝗿𝗄𝗄. We are going to have that conversation with Dr. Stephen Mutiso. He's a renowned gynecologist based here in Nairobi, Kenya. So help me welcome him. Thank you so much, Dr. for being here today.
Yes, thank you for having me.
Yes, and maybe we can just start with the basic, defining male infertility. At what point would you say that the man is infertile, they are unable to naturally have children?
So infertility is a common problem we have in our society, and it may be caused by either a problem with the man or a problem with the woman, or sometimes actually both. So for male infertility, where the problem is the man, you find about 30% of the times the man is the issue. So that's what we call male infertility, when the reason for not conceiving is actually the man. Yes, yeah.
So it means many cases are among women and not among men, because 30% men, 70% women, right?
Actually, no, it means, I mean, the male infertility contributes 30%, female infertility contributes to 30%, and then we have combined, where you have the man has an issue and the woman has an issue.
Okay, thank you, Doc.
Contributes again to another 40%.
Okay, thank you for making it clear. So before we look at the causes, because we are going to address the habits that could contribute to that, let's talk about symptoms. Are you able to know as a man, there's that anxiety, especially if you just started a family or you're planning to start a family. Are there signs and symptoms like any other disease?
Usually at the beginning, there are no signs and symptoms. Yeah. But we normally define infertility as inability to have a conception after 1 year of regular sexual activity. So if this happens, that's when we suspect and we start investigating. Actually, both couples. Yes.
Okay. So let's now talk about how can couples know when it's time to seek medical help? Is it just maybe after 1 year or even before?
Usually we advise if 1 year has elapsed without pregnancy, then that's the right time to seek medical assistance.
Yeah.
However, for couples who are a bit elderly, like 35 years and above, they can actually seek medical assistance even earlier than that, about 6 months of trying.
Okay.
Yes, yeah.
So 35 years, why 35 years? Does it?
It's actually because 35 years because...
is it for both men and women, or women who are above 35 years?
It's usually for women who are above that 5 years, because it becomes more difficult to conceive after that.
Okay.
And with time, actually, the ability to get pregnant reduces. And therefore, this age group requires more urgent, more aggressive approach, so that one is able to conceive before actually the ovaries fail. Yes, yeah.
Okay. So let's now talk about the causes. Let's start with the uncontrolled causes, because we'll finish with the habits that one can control. So what are the possible causes of infertility in men?
So for causes of male infertility, some men are born actually with problems.
Yeah.
You find the cells which produce sperms are not well developed. And therefore this is inborn problem. And sometimes there isn't much we can do about it. Also some boys can be born with what we call undescended testes. You find the testes are not in the right place. They're actually in the abdomen. And this, in the long run, can actually cause infertility, because the environment inside the abdomen is it's too warm, it's too hot for spermatogenesis to occur. Yeah. And therefore, it's important actually for parents to make sure they check. We always check once the child is born to make sure the testes are in the right place.
Yeah.
But if they're absent, then this should be corrected before it's too late. So we have the congenital the things, problems where one is born, with a problem.
And is there a cause for that, or it's just?
It just happens. Yeah. It's just a developmental problem. And therefore, if it's detected early enough, it can be corrected, and one ends up with able to get children. And then we have the acquired things which happen much later. In this category, we have infections. They are quite common. Here we are talking about sexual transmitted diseases. We are talking about gonorrhea, chlamydia. All this can actually cause a blockage of the tubes which transport sperms from the testes.
Yeah.
So that's a very common cause for male infertility. And then we have others like infections like mumps, surgical problems like sometimes there's something we call torsion, where there is a twisting of the testes, and if this is not relieved quickly, actually the testes can die. And then then we have also other problems which affect the sperm production, like too much intake of alcohol, smoking, things like cut. All this can actually cause decline in fertility. And also some occupations, especially occupations which require the man to be in a hot environment for a long time, like driving for too long.
Yeah.
Yes, yeah. So this can actually cause problems.
I think you've really mentioned the habits. Do we have more? Because I even also, you mentioned that in people in hot environments, we've seen recently, we have men going steaming, their bodies and all that. Would you say that this could contribute to infertility? Because now you've mentioned the hot environments.
Steaming, I think for a short time, I don't think it poses a great risk. But if it becomes an habit, prolonged exposures, probably it can.
No, maybe, Doc, for a short time, how short is this? Because they are, as part of their general hygiene routine, there's some men who maybe would do monthly steaming, so maybe you can clarify on that.
When I talk about hot environment, I think I mean prolonged exposure.
Yeah.
Like you can imagine if someone is driving all the way maybe for 8 hours per day, and this happens every day, then this can actually reduce the sperm production. But once in a while exposure, like for an hour or so, I think this may not affect.
Yeah.
Yes, yeah.
Okay. So let's talk about diagnosis. You talked about the congenital, where you're able to see when a baby is born with the testes that are not in the right place, then this can be identified. But not for the acquired. You're just leading your normal lifestyle. You're planning to get married, or you have a family, because they say that early screening, early detection equals to better treatment. So for infertility in men, is there anything like early detection or early screening for this problem?
Yes, for male infertility, normally we don't screen. We only investigate men who are not able to achieve a pregnancy in a year. So if this happens, that's the time they come to us, and then we are able to take detailed history. We are able to examine them to see if everything is correct. And then after that, that's when we start doing investigations.
Yeah.
The investigations, in terms of investigations, what we start with is semen analysis. We want to know more about the sperms, whether the sperms are there, the number, whether whether the shapes are normal, and whether they are able to move, what we call motility. So this is usually the starting point. Yes, yeah.
Okay, so how do you now know that the man now is the problem? What are some of those signs that show, okay, in this marriage, then the man is the problem? There's 1, 2, 3, and 4 things going on within him.
So what we normally do, once we get the semen analysis report, we are able to look at it, and then from there we can actually figure out what is going on.
Yeah.
Most of the time, we find the report is okay. Then we have now to also investigate the woman in this case.
Yeah.
Then at times we find the report has a problem, and the problems vary. Some are not as serious, others are very serious. Of course, the worst would be a case scenario where there are no sperms at all. We are not able to see any sperms on when we analyze the sample. Yeah. So generally, once we have an abnormal sperm analysis, we also have to investigate the partner.
Yeah.
Yeah. So that at the end of the day, we can make decisions based on the findings for the two. Yes. Yeah.
So before we finish with the treatment options, what is this one habit that you'd say as a doctor, because I know you have these cases every single day, that you'd say that it's the single most leading cause of infertility in men, and if they changed it or stopped it, then probably we could experience lower cases?
Yeah, some of the habits which affect fertility in men actually include smoking and heavy alcohol intake. So these two habits actually affect sperm production, and it's important. Actually, smoking should not happen at all. And then if about alcohol, then if it's not possible to stop, I think there should be reduction. It should be in moderation. Yeah, so these two habits actually affect sperm production.
Yeah.
And they cause male infertility.
Yeah. And of course, for the causes that are preventable, if they were stopped, then we could see reduced cases. So let's talk about treatment options, and also tell us, is there a point where, because for conditions like cancer, doctors say that at stage 4, it might be hard to treat and to correct. That's why they want people to go for early screening. So for infertility in men, is this the same case? Are there cases where you cannot correct it? Are there some that, it's possible to correct it? And what is the percentage like?
So for treatment options for male infertility, actually they vary. It depends on the seriousness, severity of the condition we find. Sometimes when we check, when we do the sperm analysis, we don't find major issues. We may find the sperm count is slightly reduced, and this with micronutrient supplementation, this count may actually improve, and the man is able to achieve pregnancy. But there are also cases where we find, for example, the count is markedly reduced. In these scenarios, we need what we call assisted reproductive technologies. One of the commonest things we do when the count is reduced but not so bad, we normally do a procedure we call insemination with insemination, artificial insemination. So this one is possible. We have the man gives a sample, then we concentrate, and then we are able to push directly into the partner during ovulation.
Yeah.
So that's what we call intrauterine insemination or sperms.
Yeah.
But there are cases where the count is very low or there is none. That's when we look at options like IVF, in vitro fertilization, and in this case, actually using donor sperms. Yeah. Like if there are no sperms at all, then we have to use a donor. Yeah. The donor may be anonymous. Yeah. Yeah, most of the time. Yeah. Yes, yeah.
Okay. You know, there's a lot of, in the African setup, and there's a lot of stigma for couples that are not having children. And most of the time, apart from stigma, any infertility in our home, most of the time it's the woman. The fingers are being pointed towards the woman. So as part of making awareness and making men also come out for screening, what would you tell a couple that is probably looking forward to having children, or even a man who somehow is reluctant into coming for screening?
Yeah, so my advice for couples having a challenge in getting pregnant they should actually seek attention, both of them.
Yeah.
So that both can be investigated. As I said earlier in the show, 30% of the causes are male. So it's a male infertility. So it's important if both actually present, so that investigations can be done, and then there's quick treatment provided.
Yeah.
Yes, yeah.
Okay.
So it can be either or both can have an issue. So it's important to work this together.
Okay.
So it's not always the woman. The man can also be the problem.
Okay, well said. Thank you so much, Dr. Stephen, for making time for us. And if you're watching this show, remember to like, comment, subscribe, because if you do so, you're helping us amplify this message to a greater audience. I am Purity Musenzuki. This is the Purity Afya Show. I'll see you on the next one. Bye-bye for now.